Good morning, class 5. We are past, good morning. We are past the halfway point now. So it actually gets a little bit easier from this point because most of what we're going to do now is just kind of re-engage the principles that we've already learned. We do still have one principle left to learn, but just one out of the 11. You've already learned 10. So not too bad, right? Not too bad. All right. So the skills we're going to learn today is another range of motion. Do you guys remember the range of motions we've learned so far? We're going to learn how to provide denture care. Do you guys remember mouth care? Denture care is mouth care with an extra step. We're going to learn how to walk somebody with a gait belt. That's a pretty easy skill. And we're going to learn how to provide a partial bed bath. Now, that's the longest skill, and that's going to take the most amount of time today is a partial bed bath, okay? Before we get started, we're going to get your scores for chapters 5 and 6. Remember, the grading scale is at the bottom of page 201. It'll tell you what your grade is based on how many you missed. So when I call your name, if you can tell me either how many you missed or your grade. Emily. On both? Thank you. Michaela? Thank you. Tiana? Thank you. Mia? On both? And do you have 4 for me? Thank you. Autumn? Yenison? Ashley? Eliza? Thank you. Ariani? Ariani, do you have 2, 3, and 4 for me? Yeah, 95 for the first one, 140. Thank you. Christina? Thank you. Madison? Do you have 4 for me? Thank you. Ashanti? Thank you. All right, those of you who missed any questions, do you have any questions for me? Do you know why the right answer was the right answer? Is there anything you want me to go over with you and explain? So take just a moment to look through and make sure there's no questions. All right. Class is half over now. If you have not registered for the state exam, do so at your earliest opportunity. What ends up happening, and I've done this for 20 years, guys. So some of you are a little bit nervous about the test and you want to wait until you're a little bit more comfortable before you sign up. The problem with that is the further away you get from class, the less confident you're going to be. So if you're waiting for that confidence to just show up in the mailbox, it's not going to. So if that's what's holding you back, register for the test. You are way more prepared than you think you are. Now, if it's finances that are holding you back, that's one thing I can't really do much about. However, I want you to remember that if you wait 4 months, 6 months, 8 months to be able to test, the information that you have now will fade. It will. Think about something that you saw on social media 6 months ago. Can you recall anything that you saw on social media 6 months ago? Probably not. Well, the problem is the further you get away from class, that's going to happen. The information that I've given you is going to become irrelevant because life is going to get between this information and where you are now. Does that make sense? Okay. This has happened to a lot of students. They didn't take the test right away. They waited. And then 8, 10, 12 months later, they register to take another class with me because they don't feel confident or comfortable testing. Remember, you have the live streams. Watch the live streams. You don't have to register to take another class. Those live streams are free for everybody. Just go watch the live stream. Save yourself the money. But you probably need to make sure that you're, compressing that timetable. Okay. Right. So background comes first, then test registration. Yes. Good. Very good. All right. Game show will be on, I want to say it's the 3rd, March 3rd. It's the first Tuesday in March. So it'll be, I think, after your graduation. I'm pretty sure after your graduation. So you'll probably want to mark your calendar for that. All right, so we're going to do another brief review. This is going to be, we have one more review on Wednesday, and that'll be it. So this is, I'm going to do this very quickly, go through this, because you know all of this information. It's just to freshen us up after the weekend, okay? We're going to follow the care plan, the whole care plan, and nothing but the care plan. It's what tells us what to do with each patient. And remember, every care plan for every patient is going to be different based on their needs. While we're performing the tasks on the care plan, we're going to make observations and report those observations to the nurse. If you can't perform a skill for whatever reason, doesn't matter what the reason is, you don't have enough supplies, the patient refuses, whatever the reason is, you let the nurse know. Okay. So if you get a question on the state exam, you can't perform a skill, let the nurse know. Try to find out why, so you can report that to the nurse. Every skill starts with an opening. Every opening starts with a knock. Then we're going to greet the resident, address them by name, introduce ourselves by name and title, describe the skill, get permission, close the curtain, and then wash our hands. Once we have clean hands, we can get our clean supplies. Our cardinal rule here that we never break is that you do not touch the patient until your hands are clean. Okay. While we're getting supplies, we have to think about whether or not we need gloves. So we will use gloves if we might touch body fluids, personal skin, or non-intact skin. So this is eyes, nose, mouth, genitals, rectal area, wounds, rashes, sores, or incisions, as well as any body fluids that you might come into contact with, like saliva or something like that. If none of those apply, you don't need gloves. Wash your hands before, wash your hands after. Your skin is the best glove you will ever have, as long as it doesn't have any holes in it. Good? Now, if you do decide to wear gloves, the first thing they should touch is the patient, not the supplies, not the environment. Keep those gloves clean for your patient. Once you have touched the patient, though, now your gloves are soiled. So be careful about what you're touching in the environment with those soiled gloves. And then if you are at the end of the skill, if you're going to remove those gloves, you want to do it without contaminating yourself. So you pinch up and then you go under. Good? Okay, when it comes to supplies, we have to have a clean place to put them. That's what a barrier is all about. We only touch our supplies with clean hands. We don't hold them up next to our uniform. And we're going to go get that barrier first, put it on the table, and then put the supplies on the barrier. That keeps you from holding the supplies up against you. One of the supplies you may need is a privacy blanket. This will not be on the care plan. Care plans don't tell you use a privacy blanket. This is something you have to know. We are going to use a blanket to keep somebody warm and provide privacy. It has two jobs, not just privacy. We'll use it anytime the patient is uncovered or undressed. You put the blanket on over the sheet. Don't snap it or shake it. Just put it on over the sheet. Pull that sheet down underneath. Now, if you use a privacy blanket and gloves, you need to remove the gloves before you remove the blanket. That way you're not touching that sheet with soiled gloves that are going to go right up next to the face. Good? Linen rules. Linens can't touch uniform. We already know that. You have to have clean hands to get your linens. We already know that. You don't snap or shake linens. We already know that. Clean rolls toward me, dirty rolls away. We use this anytime we're putting something under a patient. This is how you put stuff under a patient. Clean rolls toward me, dirty rolls away, and you don't let anything touch the floor. If you take something you don't need, don't use, we still put it into dirty linen. Okay? We don't save it for later. We learned how to keep our patients safe in the middle of the bed, and we have to promote safety without the use of side rails. So even if there's side rails on the bed, it doesn't count for the test if you use them. The patient must be in the middle of the bed at all times. Now, if we are going to turn the patient, they have to be in the middle after the turn. So you scoot them towards you and then roll them away. We remain behind, the patient's behind. Okay? So always roll them away from you. We learned washing rules, and we're going to use this again today. What, bless you. Basins are no soap zones. Don't add soap to the basin because then you have no rinse water. We're going to use a paper towel to turn our faucet on. We'll check the water with the inside of our wrist. It should feel warm, not hot, not cold, just warm. The patient is always also going to check that water to make sure it's comfortable for them. Good. Change that water out if it gets cold or soapy. We're going to use the leaves method when we're washing wet body openings, which we're going to talk about today. I'm going to teach you a new way of holding a washcloth. So just kind of keep this in the back of your mind. This is something we're going to learn today. And we want to make sure we don't get our surface wet wherever we're washing. So if we're doing hand care on the table, you want a barrier on the table. If we're doing foot care on the floor, you want the barrier on the floor. If we're washing something in bed, you want to cover the sheets with something, a towel or a barrier or something to keep those sheets dry as we do this. If we use lotion, we warm it up in our hands and then wipe off the excess after we apply it. If we wash something, and chances are we're going to have a basin that held water. So how do we clean those basins? Easy for the test, rinse it, dry it, store it. That's all we have to know for the test. Rinse it, dry it, store it. But if you have to disinfect, this is the process you would use. And then we learned the closing, which is how we end every skill. We want to make sure the patient is in a clean and safe environment. Make sure the bed is in a low position. Ask them if they're comfortable. They need to hear that word. We're going to address preferences. So do you want a magazine, crossword puzzle book? Would you like your phone charger? You just make sure they're comfortable. We want to adjust the head of the bed if they request it. This is one of those that you really don't have to physically address unless they say something. So remember with dressing that we put the head of the bed up to put their shirt on. You guys remember that? At the end of the skill, I can leave the head of the bed up because they might want to watch TV or eat a snack. I could put the head of the bed down because maybe they want to take a nap, but I'm probably going to ask them, are you comfortable? If they want the head of the bed down, they'll let me know. If they say something like, yes, can you put the head of the bed back down, and you don't address it, that's a problem. Make sense? Good. Okay. Where am I? Oh, give them their call light, open the privacy curtain, and then you're going to go wash your hands. If documentation is required, you would document after washing hands and then wash your hands again, because we must end skill with clean hands. Good? All right, we learned how to take a pulse. Pulse is a measurement of how many times the heart beats over 1 minute. Normal is between 60 and 100. We never use our thumb to take a pulse, 2 fingers. If you use the tips, you'll pick it up easier than using the flat part of your fingers. This has more nerve endings. You can feel the pulse a lot better with the tips rather than the flat part. For the test, you're going to say start out loud, so the evaluator starts counting when you do. You'll say stop out loud when you stop counting at the end of that minute, and this is a documentation skill. Dressing a resident. We remember this by USA first. Undress strong arm first, and then you'll dress the weak arm first. We're going to ask them what they want to wear. We're going to get their clothing before we undress them. We're going to make sure everything is neat after they're dressing, and don't overextend or force movement. Just provide support as we're dressing. Hand and nail care, mini-mani. We're going to use our washing rules here. We're going to put the hand in the basin to soak it, take it out and put it on a towel to wash, put it back in the basin to rinse, take it out and put it on that same towel to dry. After it's dry, we'll clean the nails with the orange stick, wiping it off in between each nail. And then we'll file the rough edges with an emery board. Apply lotion last and wipe off that excess. Hand and nail care, mini-mani. We learned how to make an occupied bed. This is changing the bed with somebody in it. And the way we do that is to change that bottom sheet a half at a time. So we're going to get the patient on their side, clean rolls toward me, dirty rolls away. So the sheet that's on the bed is the dirty one. It's going to roll away toward the patient, tuck it up under them. Put the clean sheet on, roll it toward us, tuck it up under the dirty. Put them back on their back, go around to the other side of the bed, do it all again. Take that dirty sheet away, unroll the clean, secure the corners, and then top sheet pillowcase. Pretty easy. Okay. Make sure they end up in the middle of the bed and not on the floor. Nothing goes on the floor. Not sheets, not washcloths, not clean, not dirty, and definitely not the patient. Okay, good. Side lying position. I love this skill. This is one of my favorites. You're going to get the patient to scoot towards you, furthest arm up, closest arm crosses, closest knee bent, furthest knee angled. So they look like this. And when you get them in that position, they just roll on their side, super easy. Doesn't require a lot of force for you or them. You roll them on their side. We're going to put a pillow behind their back to prop them there. One between their legs, specifically between the knees and the ankles. Make sure that top leg is just offset a little bit. The top arm needs to be supported with a pillow, and then we'll adjust the pillow under the head. Call light goes in that bottom hand. Foot care, just like hand and nail care, a little lower. We're going to soak the foot, take it out and put it on a towel to wash, put it back in the basin to rinse, take it out and put it on the towel to dry. Nothing with the toenails. We don't clean them, we don't file them, but we do look at them. If you notice anything funky, who do we report it to? The nurse. We're going to warm up that lotion, put it on, make sure we're looking at the foot, no lotion between the toes. Wipe off the excess lotion, put their sock and shoe back on. That's foot care. Mouth care, don't overthink this. You're brushing somebody's teeth, but they need to be in a sitting position, so get them sitting up for this skill. This is a pretty easy skill. You do have to wear gloves because you're working with saliva. You're going to dip the toothbrush in the water, put some toothpaste on it, and brush. Top, bottom, front, back, brush. Then you let them rinse as much as they need to. Leave their mouth dry. You've got to dry their mouth off. That is the number one step that gets missed on this. And then just clean the basin like we clean all basins. We learned how to count respirations. This is breathing. In and out counts as one breath. Normal is between 12 and 20. You are going to say start when you start counting, and at the end of the minute, you'll say stop when you stop counting, so those evaluators know how long you counted, and they can count at the same time. This is a documentation skill. Range of motion. CNAs do exercises to retain function, so we do not inflict pain. Retain, no pain. Okay, so flexion extension is up, down. Abduction, adduction is side to side. Rotation is around, but we don't do rotation for the test. We're going to follow the care plan for the joints we're exercising, the exercises we're doing, and how many repetitions. Provide support from below as you're moving, and you've got to go all the way back to start. Very important. All the way back to start. And that's where we're going to start today, is with range of motion of the hip, knee, and ankle. This is our last range of motion. Do you guys see how much you've learned in 2 weeks? It's a lot of information. Now, I just summed it up in 20 minutes, but it's a lot of information. Am I going too fast for anybody? Did any of that sound foreign to anyone? Do you have any questions about anything I said? All right, so if you look at page 80, you can see all the principles involved in this. We know them all. We know skill rules, we know the opening, we know glove rules, and we know the closing. We even know range of motion steps. So there isn't anything new to learn with this other than what makes it different for hip, knee, and ankle for this particular joint. At the bottom of the screen, you'll see that somebody with your level of experience should be able to do this in 4 minutes or less. And this is going to be done on a live person. That might mean you. So if you look at page 81, we have our care plan at the top of the page. We have step-by-step instructions, and there's no supplies required for this skill. Here's our care plan. Provide the following range of motion exercise to the resident's right hip, knee, and ankle. Which side are we doing? Right. Can I do both while I'm there? Why? Easy answer. Not on the care plan. So if on the test you go in and you start exercising things that aren't on the care plan, are you expecting to pass? No, you're not going to, because you did not follow the care plan. Make sense? It really is that easy. A lot of students go in and they think that they're going to get extra credit for doing extra things, and actually that's what fails you. All right. So our exercise for this one is flexion extension. If you remember, flexion extension was up, down. So we're going up, down on the hip, knee, and ankle. That's it. We're going to do that 3 times because our care plan says to provide 3 repetitions. It also tells us the patient cannot assist with the exercises. So we're going to do the work here. We already know everything we need to know to do this. But there's something about this particular range of motion I have to go over with you because it's not really intuitive. Again, we're going to look at the care plan for the body part, the joint we're exercising, the exercises we're doing, and how many repetitions. We're going to follow that care plan. We're going to lift from below and provide support at both joints. But when we're doing this particular exercise, this flexion extension, the ankle, pretty easy, right? Because the ankle is just flex and extend. We can do that. We're going to go, remember, all the way back to start. But that hip and knee has to have a little special consideration, okay? Little special consideration. So flexion extension is an up-down motion. When we are flexing the hip and the knee, we're going to do them both at the same time. And this is really important. Most of you guys are young. You're still very bendy. As we get older, our bendiness tends to decrease. And you don't know that yet because you're still young and bendy. So we have to kind of talk about this a little bit. So when we are doing flexion extension of the hip and the knee, we're going to do them together. So as you can see here, I've bent the hip and the knee. Both of them are bent. And this looks like the patient is climbing stairs. So we take that knee, bend it, bring it up to the hip, and that bends both the hip and the knee at the same time. So 2 for 1 exercise. The reason for that is if you raise that leg straight, it's called straight leg raise. If you raise that leg straight, it can pull on the sciatic nerve. Now, the sciatic nerve, if you look at this illustration of nerves, by getting old and stiff. Okay. This nerve that comes from your spine comes directly from your spine and goes all the way down into your foot. One nerve makes that whole big trip, kind of like I-75, okay? Whole big trip. Well, as we age, these nerves get tighter. Think about a rubber band, a brand new rubber band, super stretchy, but that rubber band in a drawer for 20 years is going to get brittle. It's not going to stretch as well. Make sense? Okay. That's what's happening here. It's not stretching as well. So when we stretch this leg in a straight leg raise, this pulls on the nerve right here. It pulls it tight. And that sets off a cascade reaction that can cause pain for this patient for months. not minutes, not hours, not days, months. This one exercise can cause this person to have pain for months. So we don't ever do this as CNAs. You don't do a straight leg raise. When we are working with patients, if that hip is bending, that knee had better be bending as well. And that keeps this slack. Good? Make sense? Okay. So when we are doing this particular exercise, we're going to bend the hip and the knee together. So the knee goes to the chest and back down to the bed 3 times. And then we're going to lift that leg off the bed just a little bit to push that foot forward and back for the ankle 3 times. But you want to support the foot. You don't want that heel to scrape against the sheets, okay, because the skin can get affected. It can have a friction burn. So we want to lift that ankle up off the sheet just a little bit. And that way, when we're bending the foot front and back, that heel is not scraping. Make sense? Super easy. All right. So this skill is knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to do some exercises. Is that okay? I'm going to close your curtain, wash my hands, get my supplies. I'll be right back. I wash my hands, I come back, there's no supplies, so that's easy. I'm going to stand on the correct side of the bed. Remember, this care plan is very specific, which body part it wants us to exercise. So I got to make sure I'm on the right, correct, I need to say right, the correct side. And then I'm going to lift that leg, bending the knee toward the chest and back down to the bed 3 times. So 1, 2, 3. And then I'm going to come down to the end of the bed, lift the foot off the bed a little bit, and bend the foot forward and to the head 3 times. 1, 2, 3. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Environment's clean. Bed's in the low position. I'm going to open the curtain. Here's your call light. Go wash my hands. And I'm done. They give you 4 minutes to do that. You guys notice that the opening and the closing took longer than the actual skill on this one? So it's not a hard skill. It's really not a hard skill at all. All right. So we're not doing abduction, adduction. We're not doing rotation for this one. We are asking if they have any pain. So now let's take all of these principles, apply them to our checklist, and see how we're going to check them off. We're going to follow that care plan. We're going to do our opening. We're going to evaluate if we need gloves. We may not, probably won't, but you might. If your patient is incontinent, not wearing undergarments, then you're probably going to need some gloves. We're going to follow our skill steps for range of motion. Lift from below with a flat palm, move slowly and smoothly all the way to the start position. Flexion extension is up, down. Monitor for pain. And we're going to do our closing. That's the whole skill. Remember, the skill is just for this patient, not for any other patient, because other patients may need other exercises or other body parts. All right, Jake's going to show us this video.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Wonderful. I need to do some exercises on your right hip, knee, and ankle. Is that okay?
Yes.
Okay, I'm going to close your curtain. Let me go wash my hands, and I'll be right back. Okay, after washing my hands, we're ready to get started.
The first exercise I'm going to do is bring your knee up to your chest and back down to the bed. I'll do all the work. All you have to do is let me know if there's any pain or discomfort. We're going to provide 2 points of support, one under the knee and one under the heel. And we're going to lift up and all the way back to the bed. Feel okay?
Yes.
Any pain?
No.
We're going to do it again. Up and all the way back. And one more. Up and all the way back. Feel okay?
Yes.
Okay, now I'm going to work on the ankle. I'm going to lift your leg off the bed just a little bit, and then I'm going to bend your foot forward and back. You should feel a little stretch. Please let me know if there's any pain.
Okay.
So I'm going to lift under the ankle. We're going to bend the foot forward and then back. Feel okay?
Yes.
We're going to go forward and back. Feel okay?
Yes.
One more, forward and back. Good?
Yes.
Is there anything else I can get for you while I'm here?
No, thank you.
Would you like a magazine before I go?
No, thank you.
Are you comfortable?
Yes, ma'am.
Environment is clean. Bed is in the low position. Here's the call light. If you need anything at all, just press the red button and we'll be happy to come help. I'm going to open the curtain and go wash my hands. After washing my hands, I'll review the care plan, think about my skill, make any corrections, and then tell the evaluator my skill is done.
Questions? If I got to pick my skills for the state exam, I'd be picking some range of motion. For sure. All right, any questions on what we've gone over so far? All right, I need to preface the next skill before we get there. This next skill is the one students tell me that they struggle with the most. This is the one that students consider the hardest skill. So today is, even though we're just past the halfway point, it's overall pretty easy, but there's 2 skills today that may give you some trouble. Denture care, because it's really 2 parts in one skill, and partial bed bath, because that's the longest skill we do, and there are a ton of steps. So today is not hard, but the skills themselves may give you a little bit of trouble when you're practicing. Everybody good with that? You will have some practice time in class today. A little bit later today, Jake is going to be passing around a practice time sign-up sheet for the week after graduation. That Monday and Wednesday from 9 to 1, you can come in this room. You can practice with the mannequin, with the supplies that we have. Everything is here. Try to work in groups. Try to get a study buddy, because not all skills can be done on the mannequin. You really need a live patient for most of your skills. So try to come in in groups of at least 2. 3 is best, 2 is good. But sign up for the practice times you want for those 2 days, okay? You will have a little bit of practice time today, not much. I've got a lot to teach you still. You're going to have a little bit more practice time on Wednesday, probably about 45 minutes on Wednesday. And then following Monday, a week from today, you're going to have about an hour to an hour and a half of practice time built into the class. The final day, you'll also have some time for practice as well. So now that we're past the halfway point, we're going to start bringing in some practice time. Now, during practice, we sign off. So everybody that's with us virtually right now will not get to view practice. That's you guys, okay? So I'm protecting your privacy during practice. But understand that if you're watching the replays, you're not going to get to see that practice. Good? Good? Okay. All right, so let's jump into it. This is on page 96. Now, I don't think that denture care is all that hard. It's mouth care with an extra step, and you guys already know mouth care. I don't think that this is that hard, but I do understand where the students are coming from. There really is 2 distinct components to this skill. It really feels like two skills in one. So I understand what students tell me about this. If you look down the side, there's nothing new for us to learn. We know skill rules, we know the opening, we know glove rules, we know the barrier, we know linen rules, we know how to clean our basins, and we know the closing, right? There's nothing new for us to learn there. All of that stays exactly the same. What we do have to learn is the skill-specific steps. If you look at the bottom of the page, though, it tells us our test-specific information. It tells you that somebody with your level of experience, which is none, should be able to do this skill in 13 minutes or less. Up until now, I've been telling you that there's plenty of time, way more time than you need. Don't rush. You've got plenty of time. This is, this is the one skill, the only skill that I think time could be extended out just a little bit for you to have that comfortable cushion. So for this skill especially, you need to know what you're doing. Make sense? Because you don't have a whole lot of time, extra time to play with. So this is one of those skills that you're going to have to practice before you get to the test. Good? Make sense? Now, if you look at the next icon next to that, it tells you who your patient's going to be. Who's your patient going to be? Another testing student, one of you. You guys might be the patient for this skill. But hold up, you don't have dentures. How are we going to make that work? I'm going to show you in the care plan. Okay. All right, so your patient will be sitting in a chair at the beginning of the skill. If you look on page 97, it gives you your care plan at the top of the page. It gives you step-by-step instructions, and it gives you your supplies. And boy, are there a lot of supplies for this skill. This will trip up some of you. Flashcards are your friend when it comes to learning your supplies. There's no way around it. You just got to learn it. Okay. All right. So let's take a look at this care plan. It says a resident with dentures is sitting at an overbed table with their dentures in a denture cup. This is how your patient is going to look. The dentures are already out of their mouth in a denture cup. Okay, so you can be a patient for this because dentures are not in your mouth. It then says the resident's denture needs to be brushed with toothpaste. The resident needs mouth care. I can't read today. The resident needs mouth care. The denture is stored in a denture cup after cleaning, and the resident is not able to provide their own mouth or denture care. So, at the beginning of the skill, we have a patient with a denture in a cup on a table. We're going to take that to the sink, clean it, and then our care plan says that we store it in a denture cup after cleaning. So at no point during this skill at all are you going to have dentures in your mouth if you're the patient for this. Make sense? This is why we have to follow the care plan, because dentures are probably not going to fit in your mouth. You have teeth there. Okay, good. Good. All right. So we know all of these principles. There's nothing new to learn here. So let's focus on our skill-specific steps. So CNAs clean both the dentures that came out of the mouth and the mouth they came out of. And there's a couple of different types of dentures that we might encounter in a clinical setting. When we talk about dentures, we generally think of this. This is a full plate. Okay, full plate. This is actually a top denture. I know that because it's got a palate. This is the part that kind of sticks up against the roof of your mouth, holds it in place. So this is a full plate because all of the teeth have been replaced. But if somebody has some healthy teeth remaining, we don't like to pull healthy teeth. So sometimes your patients will have a partial. Now, a partial, this is a bottom plate because it doesn't have that part in the middle. See how it's missing that part in the middle? Right. So this part is up against the roof of the mouth. This has a cutout because that's where your tongue rests. This is a bottom plate. So this bottom plate is called a partial because it replaces some of the patient's own teeth that were pulled, but it also has cutouts for teeth that remain. Okay, good. And then you have something called a bridge. Now, a bridge is just a small piece of a denture. It just replaces one or two missing teeth, usually clips onto the teeth around it to hold it into place. You won't see these as often anymore because bridges are often implanted now. So our technology has advanced over time. And while you'll still see dentures quite often, we do have full implants. Yes, absolutely. But they're very expensive. They're not accessible to a lot of people. So you're still going to see regular dentures. As technology evolves, things become a little bit cheaper, implants will become the norm. Okay, but we're not there yet. So we have to understand this. Good? Questions? All right, so we have full plates, we have partials, and we have bridges. They're all cleaned the same way. So when we're talking about cleaning, there's two different ways that we can clean dentures. One of them is with a toothbrush and toothpaste, just like you clean your own teeth. If you were able to take your teeth out and clean them, you know, this is how you would clean them, same way you clean them in your mouth. But there's another way that's actually a little bit better because toothpaste is abrasive. It has little particles that scrub your teeth. And that scrubbing makes little micro cracks. You can't see them, you can't feel them, but it actually creates little micro cracks. Now, your body actually fills in those micro cracks because, you know, we're a living organism. The problem is that dentures are not. They don't get filled in. So when we clean them with toothpaste and cause these little tiny micro cracks to form, that can harbor bacteria. It can actually cause mold to grow on the dentures. It's not like the best way of cleaning. The other way of cleaning is to put them in a denture cup with some fizzy tablets. Now, those fizzy tablets break down food particles and denture paste, and then we just rinse them off and maybe use a soft brush to get off any gunk that's still left on. But the denture tablets clean the dentures using a different method than abrasive brushing. Make sense? How would I know which way to clean this patient's dentures? The care plan. So when you're cleaning dentures, your care plan is going to tell you how you're going to accomplish that. Some patients want the fizzy tablets. Some patients want toothpaste. We're going to go by our care plan for that patient. Good? Make sense? Okay. So if we're going to use toothpaste, we're going to use a very special brush. This is called a denture brush. It kind of looks a little bit like a toothbrush. Right? Looks a little bit like a toothbrush, but it has two sides to it. It has two sides rather than a toothbrush having one. The reason is that when we're cleaning dentures, we have to be able to clean the groove that fits over the gums as well as the teeth. Well, this groove that fits over the gums is going to have denture paste in it. Denture paste is stringy, gummy, sticky. And if we just have one side and we clean that with this one side, we're going to have all kinds of denture paste in our brush, and it's not going to be very effective to clean the teeth. It's going to be all gunked up. Make sense? So we have two sides. We have one that's small and tapered, and it's designed to fit into this channel beautifully. And if it gets denture paste on it, no big deal because we're not using that side to clean the teeth. We're using a second side to clean the teeth. Good? You want to brush all surfaces, all parts of that denture. All parts of that denture. And then we're going to rinse it. Questions? Okay. All right. So if we're going to use a denture brush and we're going to use toothpaste because our care plan told us to, we have to treat it kind of like a toothbrush. And remember with toothbrushes, we had to wet it first and then put our toothpaste on so the toothpaste spread around. We're going to do the same thing. So we're going to wet our denture brush. We're going to put toothpaste on both sides, but I'm not ready to use it yet, and I've got to set it somewhere. I don't want to set this on the side of the sink. I've got to put it somewhere until I'm ready to use it. So I'm going to use that emesis basin. I'm going to put my denture brush in the emesis basin until I'm ready to use it, not on the side of the sink. We don't want to get it icky. Good? Good? All right. When you're holding dentures, they can either be in your hand or they can be in the cup, but that's the only two places they can be. You cannot set dentures down on the side of the sink, in the sink, anywhere else. It is either in your hand or in the cup. That's it. When we're cleaning dentures at the sink, you want a soft surface to work over. If you drop these dentures get super slippery when you get them wet and put toothpaste on them. Chances are you're going to fumble them. If you fumble them and they fall onto a sink surface, they're likely to break. They're not that strong. So we want something soft for them to land on in case we might drop them. And that's what the washcloth is there for. Now, if you can get that washcloth over the drain and get that water to pool up a little bit, that's even better. Because then the dentures won't ever hit the bottom of the sink. They'll hit the water and just kind of slowly sink. And it keeps them from breaking. Good? Good. That's a critical checkpoint. Making sure we're protecting those dentures. So denture brush can't touch the side of the sink. We're going to put it in our basin. Okay. We're going to use cold water only for this skill. Don't use hot water. Heat coagulates proteins, and all that means is it's going to make this stuff harder to get off. Makes everything stickier to the dentures. You don't want that. So cold water for dentures. We'll brush all surfaces. We're going to rinse all surfaces. And while we have that rinsed, cleaned denture in our gloved hand, we're going to rinse out that cup, dump out the old water, rinse it out, put new water in it, and then we're going to put that denture back in the cup. Good? So that's denture care. So we wet our toothbrush, get it ready, bring it over to the sink in a basin, put a washcloth in the bottom, turn our water on cold, put our gloves on, and then we just brush. We brush the whole denture. We rinse the whole denture, we dump the cup out, rinse it out, fill it with cool water, put the denture back in, put the lid on. That's denture care. But now we got to do something with that cup. You can't just leave it over there at the sink, because if your patient needs it, they may not be able to get over to the sink to get it. So we're going to bring that cup over to our patient, but that cup is wet. It's wet. You just rinsed it and filled it. It's wet. We don't want to put a wet cup on a wooden surface because it'll warp. So what we're going to do is put a paper towel, a coaster underneath our cup when we put it wherever we're going to put it. So you can put it on the overbed table. You can put it on the bedside table. Just make sure it has a paper towel under it. We're going to put that washcloth that was in the sink in the dirty linen. And then we can carry our basin and denture brush back to the table. So now we're done with the denture part of this. There's a whole lot of steps, wasn't it? We haven't even started on the mouth care part. Remember I said denture care is mouth care plus an extra step? So we're going to go clean the dentures, get that all done, and then we're going to come back and do mouth care on the patient. This is why I said 13 minutes may not be enough time for you unless you've practiced this. This is one skill I strongly suggest you practice before the test. Now, most of you guys don't have dentures at home. So if you get the practice kit that we actually have fake dentures for you to use for practice. They have a groove. You get the denture brush. You get the tooth that we're going to talk about in just a minute. You get the dentures and the denture cup. So if you're not going to come in here and practice the week after graduation, remember, you have access to all of this in here. But if you're not going to come in here and practice, you probably want to consider a practice kit so you can practice this skill. You'll also have everything to practice all the other skills as well, which we suggest, but this one especially. So those of you that are attending virtually, a practice kit may be a really good tool for you to be able to practice before the test. All right. So first, we're going to have gloves for the dentures. Do you think the patient wants those dirty gloves in their mouth? So we have to take those gloves off and then get a new set for mouth care. So this skill requires 2 sets of gloves, one for the dentures and one for the mouth. Good? Okay. All right. So when we're cleaning the mouth, you can use a toothbrush, but remember there's denture paste in there, stringy, gummy, sticky. Toothbrush probably isn't going to be your best friend in that because all of that sticky stuff's going to get all wrapped up in the bristles. It's not going to be very effective. So we use this instead. This is a toothette or oral swab. It's soft, it's spongy, but more importantly, it has 4 cleaning surfaces. So I can swipe, turn, swipe, turn, swipe, turn, swipe, and throw away. So if I've got a lot of denture paste in the mouth, this helps get all of that off. These can also be used to clean whatever teeth the patient has, their tongue. We use it just like a toothbrush. You wet it, you put toothpaste on it, just like a toothbrush, but because it has 4 surfaces instead of 1, it allows us to clean a little more effectively. Good? Make sense? Okay, I'm going to pass all of this around to you so you can see the different types of dentures and the different types of brushes that we're going to use for this particular skill. All right, so now we're ready for the mouth care portion. We're going to wet our toothette. We're going to put some toothpaste on it. We'll put it back in that basin just to hold it for a few minutes, and we're going to get our towel on our patient. And then we'll get our gloves on, and we're going to brush whatever they got. Top, bottom, front, back. Just brush. Let them rinse and spit as often as they need to and leave their mouth dry. And then you're going to clean up, just like we did with mouth care. Put your towel in dirty linen, clean your basin by rinsing, drying, and storing. We're going to throw our toothette away, but we're going to rinse out the denture brush. Denture brush will be used multiple times. Good? It doesn't seem like a hard skill. And when you watch the video, you're going to go, well, that doesn't seem that bad. Because it really doesn't when you're watching the video. It doesn't seem that bad. But students get all tangled up in that transition from cleaning the dentures to cleaning the patient. And when do I change my gloves? When do I take the old ones off? When do I put the new ones on? When do I put the towel on the patient? You know, how does this all work? And you'll get kind of wrapped up in those steps. So I want to remind you of our glove rule. The first thing our gloves should touch is the patient. And that tells you when to put your new gloves on. Okay, good. Good. All right, so let's see how we're going to use these principles to check off this checklist. Look at that checklist. It's a long checklist. There's a lot of steps here. Great question. And the answer is no. There's nothing on here that says you have to clean the dentures first. You can clean the mouth first, but if you clean the mouth first, they spit in that basin. Now you've got to go clean the basin before you can use it to hold your denture brush when you're doing dentures, right? So because they spit in the basin, we have to go clean it. We clean it, we come back, we get our denture brush ready, we get everything, we take it over to the sink and we clean the dentures. But now we have to clean that basin again at the end. So it actually adds an extra step on if you're cleaning the mouth first, because it's all about that basin. Does that make sense? That's why I show you the way that I do by doing the dentures first and then mouth care, because that basin just holds the denture brush. It's okay for the patient to spit in. So then we only have to clean it once at the end. Make sense? All right. So we're going to follow our care plan. We're going to do our opening. We're going to use gloves for this one. And when we change gloves matters. We're going to use a barrier on the table. Nope, we're not going to take a break. We're going to make sure we're not holding anything up next to our uniform. Nothing goes on the floor. We're going to clean our basin the way we clean everything else. And we're going to follow all those steps we just went over. Then we'll do our closing at the end. This care plan is only for this one patient. Doesn't apply to anybody else. The rest of your patients may use the fizzy tablets. Some patients may want you to do mouth care before you do denture care. I don't know what you're going to find out there. The world is full of individuals, all with individual needs. But this is how we're going to do it for the state exam. Right, because our care plan specifically says the denture needs to be brushed with toothpaste. Yeah. That care plan, it tells us exactly what to do. We've got to make sure we're following it. All right, so we're going to show you this video. Now, when you're watching this video, when we start the video, I'm going to look at the clock and we'll see how long this video actually takes. Now I'm going to start timing when I start the skill, not the whole opening, the page, the supplies. I'm not going to time all that, just from the skill itself. We're going to see how long this video takes for me to do the actual skill. Okay. And this is somebody with a lot of experience who's not very slow. So remember that you're going to take a little bit longer than that because you don't have that level of experience. Okay.
Hello.
Good afternoon, Mr. Jones. How are you?
I'm well. How are you?
Wonderful. My name is Patty. I'm your CNA today, and I would like to help take care of your dentures and perform mouth care. Is that okay?
Yes.
I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. I'm going to take your dentures to the sink to clean them.
Okay.
I'll bring the denture cup to the sink on the paper towel. We're going to set it on the side of the sink and open it, placing the lid beside it, and then wash my hands. After washing my hands, I'll get my supplies. We're going to start with a barrier. This is going to provide a clean place to put our clean supplies. So we'll spread the barrier out on the table with the absorbent side facing up. And for this skill, I'll need a towel and a washcloth, being careful not to let the supplies touch my uniform. I'm just going to go gather the rest of your supplies. I need a toothette, a denture brush, and toothpaste, along with an emesis basin and a cup of water. We'll set these on the overbed table. And I need 2 sets of gloves. Okay, I'm going to get the denture brush ready. We're going to wet it and apply just a little bit of toothpaste on both sides. Set it in the emesis basin right now. I'm going to take the washcloth, a set of gloves, and the emesis basin holding the denture brush to the sink. Mr. Jones, I'll be right back. I'm ready to clean the dentures, so I'll set the prepared denture brush in the emesis basin on the side of the sink. I'm going to place the washcloth in the bottom of the sink over the drain and put my gloves on. I'll take a paper towel and turn cold water only on, because we only wash dentures with cold water, and we're going to throw that paper towel away. Now I can clean the dentures. I'm going to take them out of the denture cup and rinse them off, making sure that I hold them over the sink at all times. I'll take the denture brush, and the small end of the denture brush is going to clean the groove part of the dentures. So we're going to clean that whole groove, all areas, and the palate. Then we'll turn the dentures over, being careful to hold them securely, and use the other side of the denture brush to clean the teeth part of the dentures. We want to make sure that we cover all surfaces. Making sure that we hold it securely. And then we can rinse the denture brush and put it back in the emesis basin for later use. We're going to rinse the dentures off, removing all of the toothpaste. We'll take the denture cup, dispose of the water, rinse it out, and fill it with cool, clean water, placing the dentures inside. Cover it with a lid. We can throw this away and get a clean paper towel to place underneath it. I can turn the faucet off, and we're going to go put this on the patient's bedside table. I'll place this denture cup on your bedside table over here for use later. Now I can remove the washcloth and place it in dirty linen. Now I'll bring the emesis basin holding the denture brush over to the overbed table and take the denture brush out and set it aside. Now I can remove my gloves. I'll throw these gloves away. Mr. Jones, I'd like to place this towel over your chest while I perform the mouth care portion of this skill. Is that okay?
Yes.
I'll get the toothette ready. We're going to get it wet. Put a little bit of toothpaste on it. and then hold it in the emesis basin while I put my gloves on. Okay, Mr. Jones, I'm going to brush all areas of your mouth, the top, the bottom, the front, the back. So I need you to open up wide for me, please. I'm going to start in the back, on the top, both sides, and then the bottom in the back, the front, and can you bring your teeth together? Thank you. Okay, thank you very much, and we'll rinse. Okay, pour the rest of the water in there. And just make sure that your mouth is nice and dry. Okay, I'm going to place this in dirty linen, clean my basin, and then clean my work environment. I'll be right back. We'll take the basin to the sink and dispose of the contents into the sink. We'll then rinse the basin and set the basin down in the sink. We'll use a paper towel to pick it up, a paper towel to dry the inside, a paper towel to dry the outside, and then one more for the drawer. On the way to the drawer, we'll pick up the denture brush and the toothpaste, placing them in the emesis basin for storage. The supplies away, we'll use a paper towel to open the drawer. We're going to put the basin, toothpaste, and denture brush in the drawer, and then close it with the paper towels, and we can then throw the paper towels away. And now I'll dispose of all of my disposables, the cup, the wrapper, and the toothette, along with the barrier. These will go in trash. Now I can remove my gloves. We'll throw the gloves away. Thank you very much, Mr. Jones. Is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes.
Would you like a magazine before I go?
No, thank you.
Your environment is clean, your bed is in a low position, and you're safe. Let me give you your call light.
Okay.
Here's your call light. If you should need anything at all, just press that red button and we'll be happy to come back and help. I'm going to go open your curtain and wash my hands. After washing my hands, I'll review the care plan, make any corrections, and then tell the evaluator my skill is done. All right, so if you noticed, I did not rush at all during that skill. I was pretty slow, because I'm teaching you, but I'm also telling the patient every step of the way what I'm doing, and that's what you should be doing as well. And that entire skill from all the way to my skill is done is 9 minutes. They give us 13. But if you're at all unsure of what you're doing, those extra 4 minutes can go away really fast. Does that make sense? Okay. You don't have as much of a cushion with this one as you do with some of the others. Questions? Michelle says, thank you. I take my test soon, and this is what I need more practice on. Oh, well, thank you, Michelle. I'm so glad that you joined us, and good luck to you on your test. Keep practicing. You'll do great. My skills is tomorrow, and I'm happy I joined this class. So good luck, fun. We hope that you do great. Come back and let us know how you do. We'd love to congratulate you, but good vibes out to you as you test tomorrow. Yeah, and the videos are all available on our website, foryourcna.com.
Look under skills videos. All right, so any questions on that? Any questions? Okay. We talked about the practice kit. It has everything you need to practice. It has gloves, it has toothettes, it has toothbrush, it has denture brush, it has orange sticks and emery boards and barriers and gait belt, which we're going to get to next. Basins, food tray, drainage bag, triangular graduate container, bedpan, soap, lotion, and it comes in a carrying bag. So for you guys in here, this is only $49.95. For everybody else out there, I think it's $69.95 on our website, $69.99. I can't remember. All right, so now we're going to get into Ambulate. So page 66. After we go over this skill, we will take a break because the last skill is going to take me some time to teach you. So we'll take our break after this skill. I'm hoping to give you about 45 minutes, maybe even a little bit more of practice time today. Okay. All right. So if we're looking at page 66, we're going to follow the care plan. We're going to do our opening. We're going to evaluate if we need gloves. We may not, depends on the patient. We're going to learn about shoe rules because we don't know shoe rules yet. That's a principle we have to learn today. And we're going to do our closing. If you look at the bottom of the page, you'll see that somebody with your level of experience should be able to do this skill in 5 minutes or less. We're going to read the care plan in just a second to see what we have to do in that 5 minutes, but this is a short skill. This is going to be done on a live testing student, so one of you guys may be the patient for this. You're going to start out in a chair for this skill. If you go to page 67, care plan is at the top, step-by-step instructions, supplies are at the bottom. But let's look at the care plan together. This care plan says ambulate the resident at least 10 steps. How far? At least 10 steps. So we're walking them all the way to the bathroom and back. 10 steps. So be careful here that you don't add to this care plan. Okay. So for the test, it says ambulate 10 steps, but there's a round trip here. So we're going to take them about 5 steps, turn them around, and bring them back to the chair. So this isn't going to take very long. You're walking somebody 5 steps in one direction and then 5 steps back to the chair. It's not the walking that they're grading us on. It's everything else. It's the safety. It's the body mechanics. It's using a gait belt properly. That's what we're being graded on here. So for the exam, they're actually going to give you a destination. They may say walk to the door and back or walk to the table and back. They're going to give you a destination that kind of meets this, at least 10 steps rule. Make sense? Okay. Follow their instructions. Carrie says, good morning, Miss Patty. I passed my CNA exam, both the skills and the written. I'm in New York. I want to thank you because your videos helped me pass. You are the best. Thank you. Congratulations, Carrie. Great job. Thank you so much for including us in your journey. We really appreciate it. And thanks for coming back and letting us know. I love to congratulate students when they pass. So congratulations. Welcome to healthcare. All right. So now that we know what we're doing, let's learn how to do it. We already know all of these steps, but we don't know this one. So let's learn a little bit about shoe rules. This is our very last principle we have to learn. After this, we know them all, and we're just going to rinse and repeat and recycle. Okay. So on page 63, we have the notes for this principle. And this is about energy conservation. Have you guys ever seen a 2-year-old? I love 2-year-olds. They're like my favorite age. Love 2-year-olds. 2-year-olds have so much energy. They will jump up and down for no reason at all. They'll just start bouncing, right? When was the last time you jumped up and down for no reason? Probably when you were about 2, right? That's because our energy levels are highest for our entire lifespan. Your energy levels are highest between 2 and 5. That's when you peak. It's when your energy levels are absolutely the highest they will ever be. Now, it doesn't stay that way, unfortunately. And energy levels actually start to drop off pretty quick. So 12-year-olds still have tons and tons and tons of energy, way more than I do. They can skateboard, play video games, have slumber parties. They've got still tons of energy. But you put that 12-year-old in charge of that 2-year-old for one afternoon, who wins? The 2-year-old. That shows us that their energy level has decreased in that time span. Now, let's go out to 22. 22-year-olds still have tons of energy. They can shop till they drop and go out at night looking fabulous, right? Still have tons of energy. But you do not have the same energy level you had when you were 12. Go out to 42. 42-year-olds, we'll shop until we drop, but that's at like 3 and we're not going out tonight. We're done. Now let's go out to 62. 62, we're thinking about putting our feet up for 10 minutes before we make dinner because we're tired. We're considering retirement because there's just not enough energy in our day to keep up with our daily household chores as well as working. We're slowing down. Now, what do you think our level is going to be at 82? Very, very low. Now, the problem here is actually you. And that's because, have you ever, when you're talking to a 2 or 3-year-old and they want you to get up and play and chase them and run and do all this active stuff, have you ever tried to explain to them why you don't have their energy? Have you ever tried to say, I'm tired, I just want to sit? Do they get it? No, because they have no frame of reference. They think everybody has the same energy level they do. Why wouldn't they? Because that's what they experience, right? Well, the problem is that you trying to explain to this person why you don't have their energy level is exactly the same as them trying to explain to you why they don't have your energy level. You're not going to get it. You're going to say things like, why don't you want to shower? All you got to do is sit there. I do all the work. Come on. I got stuff to do. I've got care plans that I have to adhere to. You're going to try to explain to them why they should have the energy you do. It didn't work when you were 2. It's not going to work any other time when you're talking to somebody higher up on this energy spectrum. Make sense? So this is where we kind of run into trouble as caregivers because we assume that everybody that we're working on has the same energy level that we do because we never really stop to think about it. And when you badger your patients, you're going to lose their trust. So let me go back. If we only have this much energy to work with on a daily basis, we have to think about what we do on a daily basis. It takes energy. And this is what we do on a daily basis that takes energy. That has nothing to do with work. I took work completely out of this. But just getting up out of a chair takes energy. Fill in the blank. If you've ever been able to say that you've been too tired to blank, it means it takes energy. Have you ever been too tired to eat? I have. Have you ever been too tired to talk? Have you ever been too tired to shower? Have you ever felt like you're too tired to sleep? Kind of sounds weird, right? But it's a real thing. Okay, every single thing up here takes energy. Even breathing takes energy. Everything takes energy. And if this is all the energy we have to get through the day, and this is all the stuff we have to do, sometimes those two things don't meet up. Make sense? So let me give you a practical example of this. Have you ever seen an old person try to get up out of a chair? Call it the rock and roll method, right? Because they start doing this. They start to rock to get up some momentum. Don't try this in a rolling chair, by the way. I'm likely to fall. Okay. So they start to rock. And then they work up the energy and they try to get up and, oh, no, 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 no. And they sit back down and then they rock a little bit more. Okay. How much energy did that take? Took a whole lot more energy to do that than it would if you just stood up. So why don't they just stand up? It takes less energy. Well, because energy and strength have an inverse relationship. Think of it like a seesaw. You got energy on one side, you got strength on the other. And when energy goes down, strength has to go up. Well, we're not getting any stronger as we get older. We actually get weaker. So that means our energy has to go. Well, but we don't have enough energy. So this is a very delicate balance. Make sense? Okay. Energy and strength are an inverse relationship. So if the patient has to spend that much energy just to get out of the chair once, think about how many times they get out of the chair every day. So we get out of bed first. Then we get to the bathroom and we sit down on the bathroom. Then we got to get up off of that toilet. And then we come back to the bedroom and sit down so that we can get dressed. Then we got to get up. And we walk to the dining room and we sit down in the chair to eat. And then we have to get up. And we go back to our room and to the bathroom and we sit down on the toilet and then we have to get up. And then we walk to an activity room and we sit down and watch TV. And then we have to get up. And we're not even at 10 a.m. Now remember, each one of those get ups took a ton of energy because they don't have strength. Make sense? So we got a couple of options here. Number one, we can help improve their strength so they don't have to use as much energy. And this is where we want to make sure our patients get out of bed. We want to make sure that they're active. We involve them in activities. We actually have activities departments where they do things, even things like chair yoga or chair aerobics or just walking up and down the hallway or making sure that they're doing things independently as much as possible. But the more that we can do to help improve their strength, the less energy each one of those up and downs take. So that's number one, encourage independence. Encourage activity. Make sense? Okay. Number two is we can help loan them some of our strength so they don't have to use as much energy. And that's what this skill is all about. I'm actually loaning them a little bit of my strength. Okay, good? Make sense? That's what this skill is all about. So as we're doing this skill, one of the things that I need to explain to you is about diabetes. Now, diabetes is a very complex, very complicated disease. And I'm really going to simplify this down to 5th grade level for you. So understand this is, I'm not giving you all the details. Okay. People go to school for years and years and years to study diabetes. I'm giving you a 5-minute lecture on this. So I'm going to skip over a lot of the nitty-gritty details. Big, broad strokes. Good? Okay. So when we have a normal functioning system, normal cells, what happens is those cells actually need fuel. Every cell in your body needs fuel to be able to run. just like your car does. In fact, I got to go gas up my car today because it just told me as I drove in, it's low on fuel. So I've got to gas it up. Well, all of your cells are exactly the same. They need fuel to run. Well, the fuel that your cells use is sugar. That's what your cells run on, is sugar. Now, sugar gets a bad rap in our society. Sugar isn't bad. Sugar in excess is bad. But sugar itself is not bad. So what ends up happening is the cell gets hungry. It tells your brain, hey, I'm starving. And your brain says, okay, well, we need a quick source of sugar to feed these cells. And the quickest source of sugar is carbohydrates. So those carbohydrates get eaten in the form of bread or rice or pasta or potatoes or sugar. And that carbohydrate breaks down into sugar. Now that sugar is going to go into the bloodstream. Now it can't get into the cells though. Do you see the cell has a door on it, right? The sugar can't get into the cell by itself. That cell needs a key to open the door. Now that key is actually made in your body. It's made by your pancreas and it's called insulin. So you eat carbs, carbs break down into sugar, goes into the bloodstream, and your pancreas produces insulin. That also goes into the bloodstream. That insulin unlocks the cell, the sugar enters the cell, and now it's happy. Good? That is a normally functioning system. So when we have sugar detected in the bloodstream, the pancreas produces keys. Those keys, pancreas is just a factory. Those keys unlock the door, open it, and then the sugar is able to enter the cell. Now, in diabetes, the system itself is still supposed to work this way. Your cell says, I'm hungry. Your brain says, need energy, need sugar. We need carbs. So you get hungry, you eat some carbs. Those carbs break down into sugar that goes into the bloodstream. Now, that sugar can't get into the cell without the key. This is where diabetes becomes a problem because our pancreas doesn't make keys anymore. Or it might make keys, but it's the wrong kind of key. Like we're looking for a house key, it's making car keys. Not going to help us a bit. Still a key, but not the right key. Got it? So without the key, that sugar just stays in the bloodstream. It doesn't get into the cells. So the cells keep starving. They keep telling the brain, I'm starving. And the brain says, we must need sugar. So you end up with cravings. Anybody know a diabetic? What do they want? Sugar. Yeah, cookies and candy and all the good stuff, right? It's not because they have weak willpower. It's because their cells are starving. And the cells are telling their brain, I'm starving. You need to do something about this. I'm dying. So the patient eats sugar. What the brain doesn't know is we got plenty of sugar. We don't have sugar in the cells. That's our problem. So the brain can't differentiate. So with a diabetic patient, we have a lot of sugar in the bloodstream, but it's not getting into the cells because the pancreas is our problem. Good. Now, what does this excess sugar in the bloodstream do? That's what we've got to figure out because that's where our problem comes in. So we have a patient who's diabetic, who is craving sugar. And of course, we yell at them, don't you know you can't eat that stuff? You're diabetic, right? We get all mean with our patients and stuff. We shouldn't do that. They're responding to a very real physiological signal. Their cells are literally starving. They're dying. They're dying. Those cravings are a very real signal from the body that something is very, very wrong here. Don't shame your diabetic patients. I'm going to give you a tool you can use to help them, but don't shame them, okay? Everybody understand this? All right, so we've got this excess blood or this excess sugar in the blood. And sugar is a crystal. If you looked at a crystal under a microscope, it would look a whole lot like this. Okay, this is what crystals look like under the microscope. I actually grew this one with my granddaughter. Crystals are sharp, jagged, pokey little things. Now, this is what's inside the bloodstream. Sharp, jagged, pokey little things. And these crystals, as they circulate through the bloodstream, they accumulate on the inside of the arteries. And that makes the arteries very stiff. But because they're sharp, pokey, jagged little things, they're going to catch everything that drifts by. So it's going to catch your blood cells and shred some of them because they're sharp. It's going to catch the cholesterol in your bloodstream that's floating by. Cholesterol looks like pizza cheese under a microscope. So it gets all gummy in there. So what we end up with is on the inside of our arteries, we've got a stiff, sharp, pokey, gummy mess. Well, why do we care about that? Well, when we are born, our blood vessels look like this. This is a beautiful blood vessel. Oh, man. This is like brand new, straight off the assembly room floor, right? This is great. These blood vessels, blood can get through there no problem. It's not obstructed at all. These blood vessels are still very elastic. They can expand and contract when they need to. So we control our blood pressure really, really well with these blood vessels. But they don't stay like this because over time, our eating habits, carbs are good. So we end up eating more carbs than we need. Remember, sugar is not bad. Sugar in excess is bad. Well, carbs taste good. So we end up eating more than we need. And then we end up with an artery that's slightly narrow. Do you see how this one's just a little bit smaller than this one? Just a little bit smaller. The walls are just a little bit thicker, and we've got some plaque growing here, right? Well, the amount of liquid that's able to go through this opening is more than the amount of liquid that's able to go through that opening. Can you see that? So that means there's going to be more pressure inside here. That means that we have higher blood pressure now. If we don't change our ways, if we don't address this, then we continue on with our eating habits, our arteries look more like this. Now we're really in trouble, right? Because our arteries have gunked up. There's not much room here for blood. Now, if you remember what I said the other day, blood that slows down or stops clots. Now, what are we at risk for here? Blood clots. Yeah. So if the blood clots happen in very, very, very small arteries in our heart or our brain, these are heart attacks and strokes. So we're at risk for heart attacks and strokes here. Now, if we really don't change our ways, if we don't take this is diabetes now. If we don't take this seriously, this is what our arteries end up looking like. And that is a clot. That is a clot. So the whole goal here, guys, is to keep our arteries from getting gunked up to begin with. If we don't have insulin to open the cells so the sugar can go into the cells where it belongs, if that sugar stays in the arteries and circulates, this is where we're going. There's no way around it. This is where we're going unless we change our ways. Most diabetics won't change their ways. They're set in that mindset, especially when their cells are screaming at them, I'm starving. They go looking for the M&Ms. They go looking for the cookies. They crave carbs, and that's a very real craving. But if you can get your patients that are eating, that are diabetic, but they're eating sugary things, get them to add in some protein with that sugar. So I know you want that cookie, but if you have an apple with cheese slices, or if you have a half of a tuna fish sandwich, or you have some peanut butter crackers, if you add protein into that carb, instead of just simple carbs, just plain sugar, we want to add protein with complex carbs. When you do that on the back side of that cell, right? We have the big front door where we need insulin key to open the front door and let the sugar in. This doesn't work on that. There's a very small back door on the cells that protein can open, and it can let some of that sugar in. Well, what that does is it tones down those cravings, because now your cells aren't saying, I'm starving. So when we have a diabetic patient that's reaching for that bag of M&Ms, instead of berating them, help them make a better choice that includes protein. Okay, good. Makes sense? Makes sense? I heard a rumor a long time ago. I've got no way of verifying this, and it's not a good strategy, but I heard a rumor a long time ago that this is how peanut M&Ms were made. Is they added the peanut, because peanuts have protein, to the chocolate to help with this. Now, I don't recommend reaching for a bag of peanut M&Ms, but it's kind of an interesting theory if that's really why they were created. Kind of neat. All right. So why do we care? Well, on planet Earth, we have gravity. So we have these sharp crystals, and they're heavy. Crystals are heavy. So those sharp crystals that are circulating in the bloodstream are going to be pulled down to the lowest parts of your body. Well, what's the lowest part of my upper body? My fingers. What's the lowest part of my lower body? My toes. So diabetic patients are going to have more effects of this sugar accumulation in their hands and their feet. Hand care and foot care. That's why we do them. We're looking for signs of problems in these two areas. Well, why would we be looking for? Wouldn't the patient tell us if there's a problem? Well, the arteries aren't the only thing that gets affected by this excess sugar. Nerves do too. Now, your nerve is kind of like your electrical line, okay? So when you have a lot of excess sugar in the body and it covers the nerve, that foot, that toe that has a wound on it, the toe knows the wound is there. The toe can feel the wound. But when it tries to send that signal from the toe up to the brain, that line in between the two, if it's covered with sugar, that signal isn't going to go. So the toe knows there's a problem, but the brain does not. And this is why we have to look at the feet with diabetes, because gravity pulls the sugar down. It's going to coat the arteries and the nerves, which means signals aren't going to get back to the brain to let the patient know that there's a problem. So for instance, if you stepped on a thumbtack, something like this. If you stepped on one of these metal thumbtacks, you would know it. You'd hop around on one foot going, ow, 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 get it out. It hurts. You would know it. But if your patient has lines, nerves that look like this, and they step on a thumbtack, they may not even be able to they may not even register it. They may not know that there's a thumbtack in their foot, because that signal never made it to the brain. Make sense? Good. So when we have diabetic patients, we should never, ever, 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 ever walk them without shoes. Because if they step on a thumbtack and they don't know it's there, it may be days before anybody finds it. And by then, it may be too late. We may not be able to heal that wound. And this is how a lot of amputations happen with diabetics. A wound occurs that goes undetected and gets worse because of lack of treatment. Now, let's talk about healing, right? If we've got our blood vessels that shrunk and shrunk and shrunk and shrunk and shrunk, and we've only got this much space for good blood to go through, that means that we're not going to be able to get good healing properties to the area of injury. We're not going to get the right white blood cells. We're not going to get good platelets. So your patients, when they get injuries as diabetics, are much more likely to have those injuries be much more serious. They're not going to heal as well. Make sense? So when we have diabetic patients, we need to make sure that they have shoes on when we're walking them. Good? But the problem is we don't always know who's diabetic. We don't always know because maybe they haven't been diagnosed yet. Come on. Okay. Maybe they haven't been diagnosed yet. So in reality, we probably need to make sure that we have shoes on everybody when we're walking them, not just diabetics. But there's another problem with just slipper socks. Let's say our patient doesn't have diabetes. We know they don't have diabetes. They're fine. If we decide to walk them around with slipper socks, you know, the socks that have just little dots on them, right? That doesn't necessarily protect them from other things other than slips and falls. And let me give you an illustration here. If your patient has slipper socks on and they get out of bed and they walk to the bathroom and they do whatever they're going to do in the bathroom, and then they come back to bed and they climb into bed, what's climbing into bed with them? Ah, there it is. Whatever was on the floor. Now, remember, in healthcare, we go in and out of all kinds of patients' rooms, and we've got all kinds of stuff on our shoes. And that means that patient walked through all of that stuff to get to the bathroom, not to mention what's actually in the bathroom. Would you want those pathogens in your bed? Those are really gross pathogens. This is urine and feces and wound drainage, maybe even blood. Would you want to sleep on sheets that had other people's urine and feces and wound drainage and blood? Let me put this a different way. How many guys have ever been into a Walmart bathroom? Okay. Would you be comfortable walking around on that floor with socks on and then wearing those socks home? It's the same thing. Does that make sense? Same pathogens. Actually, the ones in the hospital are a little bit worse. Now, if it's not something that we would do at Walmart, let's not ask our patients to do it either. Make sense? Not to pick on Walmart, but you know. So when our patients are out of bed, they really should be wearing shoes. That prevents pathogens from getting onto their socks that would then get into bed with them, especially if they have any open wounds. Wounds, incisions, sores, rashes, anything that pathogens can get into. Good? Good. Slipper socks don't just, they don't do a great job protecting against slips and falls. They tend to rotate around on the foot and you end up on the slippery side. They don't do a great job. So the alone slipper socks really shouldn't be used for walking. If we're going to walk somebody, make sure they have shoes on. Protects them against pathogen, protects them against slip and falls, and it protects them against injuries that might be lurking on the floor. All right.
We're going to learn how to use a gait belt now. Now, this is a gait belt. A gait belt is a flat canvas belt, has a metal buckle on it. It does not matter whether this gait belt is facing this way or this way. Nobody cares. Nobody cares. What matters is that the tag is on the inside, like every other article of clothing. So this goes around your patient's waist, not chest, waist. So we put this around our patient's waist, not yours. I'm just demonstrating on me. This goes around the patient, okay? But we want to make sure when we do this that it's not twisted. It's got to be flat. Okay? So if you look here, it's flat, not twisted. So we have it around our patient's waist. Jake, you're going to have to zoom. Once we have it around the patient's waist, we're going to take the free end here, this free end. Yeah, please. Good. Okay. We take this free end and we put it through this first guard by the alligator teeth, not through here. We put it through the first guard by the alligator teeth. And then we pull the direction the teeth are pointing. See how all those teeth are pointing that way? See how those teeth are pointing that way? I'm going to pull it the direction the teeth tell me to. If I try to pull it this way, it's not going to do anything. I need to pull it the direction the teeth are pointing. Then we want to check it with 4 fingers. So I'm going to take these 4 fingers and just put them in between the belt and the patient. Now, if I can fit more than 4 fingers in there, if I can fit my whole fist in there, it's way too loose. When I go to lift the patient, this is going to go under the breasts, under the arms, or I'll just slide right out of it. You need to have it snug enough that it stays in place. So you want it snug enough that you can only fit 4 fingers between the belt and the patient. And you really want to make sure it's snug when you do that. Now, once you have it snug enough, you're going to take this end, the free end, and put it through the second guard, just like that. Once you have it locked in place, this tail, if it's hanging down and in your way, you can just tuck it up into the belt just to get it out of your way. Okay, good. Now, that's how we put a belt on. So you want to make sure it's snug. You want to make sure you check it with 4 fingers and you lock it in and then do something with the tail if you need to. Now, to take it off, we take it out of that second guard. And this time, instead of pulling the tail, we're going to pull the buckle. So to put it on, we pull the tail. To take it off, we pull the buckle. And you pull the buckle along the length of the tail. Now, when we take this off, listen closely. If I pull this, do you guys hear that? Hear that? That's going to cause a burn. It can actually cut the patient's skin. So we don't pull it against the patient's skin. You wrap your arms around to remove it, or you can go up and over holding that buckle to make sure it doesn't hit him in the head. Go ahead, Jake. You can zoom out. And again, we have gait belts here for you to practice with, but we also have them in the practice kits for those of you who are tuning in online. All right, before we stand a patient's feet up, so we have their gait belt on, it's nice and snug, we're getting ready to stand our patient. Before we do that, we want to make sure those feet are flat on the floor. And this can be a little bit hard to see, okay? So if I'm just looking, I mean, your feet look flat on the floor, but you're kind of slouched down, right? So I'm kind of short. If I sit in this chair, put my hips all the way against the back of the chair, my feet do not touch the floor. I'm kind of a little bit on my tippy toes. If you tried to lift me from that position and I'm on my tippy toes, I'm going to pitch forward. I don't have a stable footing. So before we lift a patient, you've got to take a second to ask them, are your feet flat on the floor? Can you scoot your body forward so your feet are flat on the floor? You need to make sure that they're stable, because otherwise, as you're lifting,
their body weight is going to pitch forward and you're likely to fall. Okay? Good? Good. Before we lift somebody, we always count to 3. 1, 2, 3, and we stand. We make them a partner. You don't just grab somebody and move them. They're not a partner in that. And they may not be ready. And if they're not ready, they're going to fall. You have to have a certain amount of muscle engagement on their part. So we count to 3 before we lift. Once we have them standing, we want to ask, are you dizzy? I want to know here, are you dizzy? Because if they say yes, we're sitting down. Remember, CNAs do normal. Dizzy, not normal. I don't want to wait until I get way over there to ask, are you dizzy? Because if she says yes, what am I going to do? I have no exit strategy for that. Now, what most of you will do is try to hurry her back to the chair. Guys, she's dizzy. She's not tolerating a slow walk. You really think she's going to make it all the way back to that chair? No, you're thinking about you, not her. Get out of your own mind. This isn't about you. It's about her. She's dizzy. She's weak. So we're going to get her sitting on the floor and we're going to get some help. Because patients that are sitting on the floor can't fall on the floor. Good? Make sense? All right. When we go to help somebody sit back down after our walk is over, you've got to back them up so that they can feel that chair behind their knees and they know it's there. If you don't, if you're asking the patient to go with blind faith that there's a chair back there, it's not going to work out for either one of you. Because as they go to sit, their body is automatically going to stiffen up because they're not sure that there's something there to catch them. They stiffen up, they start to resist, and you end up with one of these things and falls occur. So you want to back them up so that they can feel that chair behind them. And you're going to ask, can you feel the chair behind you? Okay. Good. We're going to use a very specific body mechanics to help our patients stand and sit. And this is called an oblique angle. Now, we used to teach people to stand right in front of somebody, toe to toe, knee to knee, so that your feet are kind of holding their feet steady, your knees are kind of locking their knees. But the problem is there's a physics principle here. Every action has an equal and opposite reaction. So if I'm lifting 150 body pounds toward me, that means that my body has to compensate for that. So I will actually go backwards at 150 pounds of force on my lower back. I can probably handle 150 pounds. Anything more than that, and I'm likely to fall and take my patient with me. So that's not a good, but it puts a ton of pressure on my back. And over time, my back is going to degrade. I'm going to end up with back injuries. So it's not a good body mechanics stance. So instead, we're going to use this. One foot goes in front of their feet across or perpendicular. This keeps their feet from sliding out. The other foot goes parallel to the chair, and that's where your stability is. So you are standing at the corner of a chair like this. When I lift that patient, I'm lifting them this way. They're not pulling me off balance. I want to bend at the knees, not the waist, like this, not like this. So I want to bend at the knees. My thighs are what's going to do the work here. Good? All right. You want to make sure that when you're doing this, your patient's hands are on your shoulders, not around your neck. You don't want them to hold on to you. You just want their hands on your shoulders because you want to move them as a unit. If you don't have their hands on your shoulders and you're not moving them as a unit, you end up with this balance dynamic, this actually imbalance dynamic, because you're lifting from here. You're pulling from here, right, at their center of gravity. Their shoulders will start to trail behind and you'll end up with something like this. And that can cause the patient to fall off balance. So by putting their hands on your shoulders, you're lifting them as a unit. Their trunk is in line with their hips at all times. Good. Make sure you remove all obstacles. Take a look around. If you're asked to walk to the door and back, make sure there's nothing in your way. If you're asked to walk to the table and back, make sure there's nothing in your way. You don't want to have to leave your patient to try to move something out of the way. And you definitely don't want to try to steer somebody around an obstacle. Okay, good. All right, so we're going to look at skills. That's all shoe rules. So we're going to look at some skill-specific steps now. So we're going to put the gait belt on over clothing. I don't know why this is a checkpoint, but this means that somewhere along the way, people were putting gait belts on under clothing. It's not where they go. They go over clothing at the waist. You're going to hold the gait belt around the sides or back. The further back you can get, the better for the patient. Depends on how big your patient is, though. If I'm working with somebody that's 150 pounds, I can get my hands nicely around them, no problem. But if I'm working on somebody that's 400 pounds, right, their middle's a little bigger, I'm not going to be able to get my hands all the way around their middle. I'm going to have to go more on the sides. But the further toward the back you can get, because that's where our weight is. We're helping our patient lift the heaviest part of them using the belt. You want to be at the heaviest part. Never pull from the front. We don't pull somebody up from the middle like that. Okay. So this picture actually shows you what I mean about having their hands on your shoulders to move as a unit. Do you see how she's got her hands on the gait belt in the middle? Do you see how her shoulders are not in line with her hips? She's leaning back. That is a fall hazard right there. Having their hands on your shoulders keeps them in a unit. As we are walking them, we are going to have them slightly in front of us and to one side. So my patient should be right here at all times. They should be visible to me. I should not be pulling them. They are leading at their pace, and I'm holding that gait belt in an underhand grip, not like this. Because if they start to fall, if I've got my hands like this and they start to fall, I'm not going to be able to, my fingertips are not going to stop a 150-pound person from falling. I don't have that kind of finger strength. When you're like this, your whole arm is absorbing that weight. You're much more likely to provide some stability. Make sense? So we're going to hold the gait belt from below, and they're going to walk slightly in front of us. Now, the reason for that is this. Your patients don't just walk along, I'm fine, I'm fine, I'm fine, and they fall. They don't do that. They never do that. Patients that are going to fall tell you ahead of time that they're going to fall. They get pale or sweaty. They start to get a little woozy or wobbly. They put a hand out to the wall for stability, or they might even put one to their head or their stomach to indicate something is not right. They show you in a million different ways that something is very, very wrong. If we've got something very, very wrong going on with the patient and you don't catch it, a fall will happen. If they are right here and they are your full focus, you are watching them, you will see them get pale or sweaty. You will see them put their hand out or up or here. You will see the wooziness. You will feel them slow down. You will detect that something is wrong long before they end up on the floor. Now, our goal is to prevent a fall. Falls break things. So what we're going to do is help them to the floor and get some help. So if I'm walking slightly behind and to one side, and I've got that gait belt, and we're walking, and my patient gets a little funky on me, okay, move this so I can show you. They get a little weird on me. We're walking along. This foot goes right between their legs. This hand grabs the other side of the gait belt, and I pull the patient against me. Now the patient is stable. I am in a very stable position. They are resting against me, and I will slide right down my leg to the floor. And then I'm going to call for help. I'm going to send somebody, a housekeeper, maintenance, a volunteer, a family member, go get a nurse. I'm staying with the patient. Never leave a patient alone. And then we're going to tell the nurse they got really woozy, they got really sweaty and pale, they were going to fall, so I got them on the floor. And then the nurse will assess them and figure out the next step. But if you're holding the patient like this, you're not going to pick up any of that. If they start to go down, there's nothing you can do about it. You have no leverage here. Make sense? So in front of you to one side as you're walking, and it should be on your stronger side. So as you're walking, if they get woozy, your stronger leg, boom, right there, right in between them. Pull them back towards you to the floor. Before they even realize what's happening, they'll be sitting on the floor. Good? Never try to rush a patient back to the chair. They're not going to make it. When you get somebody standing, you want to ask if they're dizzy. We already talked about this a little bit. You want to ask then, are you dizzy? There we go. You want to ask then, are you dizzy? But as we're walking, we also want to be asking, how are you feeling? Everything going okay? But at the chair is where we want to start that. You want to control the descent with the gait belt so they don't just plop right down into the chair. You want a nice, slow, controlled descent. And then you can take that gait belt off once they're sitting. Make sure they're seated properly before you leave them and that they have access to the call light. So now that we know all of these principles, we're going to apply them to the checklist. Checklist for this one isn't too long, actually. Remember, this is only a 5-minute skill. So we're going to follow our care plan. We're going to do our opening. We'll evaluate if we need gloves. We may not. We're going to follow our shoe rules, our skill-specific steps, and our closing. And when we put all of that together, we get 100% on our state exam. This care plan is only for this patient. You guys know the drill. All right, Jake, we're going to watch this video and then we'll take our break. Good afternoon, Mr. Jones. My name is Patty, and I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. Do you feel like going for a little walk?
Yes, that'd be lovely.
I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. I'm going to clear the walkway of obstructions. Close the privacy curtain and wash my hands. Now that I have clean hands, I'll get the gait belt. Mr. Jones, I see you have non-skid footwear on. Does it fit appropriately?
Yes.
Very good. This gait belt I'm going to put around your waist. It's going to help me lift you to a standing position and provide a little stability as we walk. Is that okay?
Yes.
Okay, I'm just going to slide this around your back. Okay, and lift your arms and relax. We're going to put the free end through the first guard by the alligator teeth and pull it so that it tightens the belt. We want the belt to be snug. We want to only be able to fit 4 fingers between the belt and the patient, and then we'll lock it in place by putting the free end through the second guard. And then we'll place the free end through the top just to hold it in place.
Okay, Mr. Jones, your feet are together. In just a few moments, I'm going to have you place your hands on my shoulders, and I'm going to place my hands around your back. And on the count of 3, we're going to stand together. Okay?
Okay.
So I'll put one foot in front of your feet to keep them from sliding out, one foot beside the chair to keep me at an oblique angle. Go ahead and put your hands up here. And on the count of 3, we're going to stand. 1, 2, 3. Thank you very much. Are you dizzy at all?
No.
Okay, so at your pace, when you're ready, I'm going to have you lead and we're going to walk to the wall. I'll walk slightly behind and to one side, watching the patient. Okay, and go ahead and turn. And then we're going to walk back to the chair. Are you dizzy at all?
No.
Very good. So when you get to the chair, if you can turn around for me and back up so that your knees hit the chair, come my way just a little bit. And on the count of 3, can you feel the chair behind you?
Yes.
You're going to place your hands on my shoulders. Go ahead. I'm going to put one foot in front and one foot beside. And on the count of 3, we're going to lower. Ready?
Yes.
1, 2, 3. Being careful to bend at the knees and not the back. I'll remove the gait belt by taking it out of the second guard and then removing it from the first guard. We're going to remove it by looping it over the patient, being careful not to let any part hit the patient. And are you comfortable?
Yes.
Could you slide back so that your hips are against the back of the chair? Very good. I'm just going to go put the gait belt away. Are you comfortable, Mr. Jones?
Yes, ma'am.
Is there anything else I can get for you while I'm here?
No, thank you.
Okay, your environment is clean. I'm going to hand you your call light. Here's your call light. If you need anything at all, just press that red button and somebody will be happy to help you. I'm going to open your curtain and wash my hands. After washing my hands, I'll review the care plan, make any corrections that need to be made, and then tell the evaluator my skill is done. All right. Any questions on that? Any questions? Okay, when you're practicing, like I said, we should have about an hour of practice time or 45 minutes of practice time today, somewhere in there. When you're practicing, the gait belt is up here for you guys to be able to use, okay? If you want to practice that one. All right, any questions before we go on break? All right, let's take our 15 minutes. Okay. Okay. So the next skill that we're going to be doing is partial bed bath. If you look at all of these principles, they're all things we already know. We know to follow the care plan. We know how to do our opening. We know to decide if we need glove rules. And for this one, we will, because we're going to be touching eyes, nose, mouth, right? Those are body openings. We know to use a barrier, privacy blanket. We know all the linen rules. We know to keep the patient in the middle of the bed. We know washing rules and basin cleaning, and we know the closing. So there's nothing new to learn here other than our skill-specific steps, which we're going to go over now. Down here, though, this skill, they give you 19 minutes to do. It is the longest skill that we have to demonstrate, 19 minutes. Now, not everybody's going to get this skill. Remember, there's 20 skills. They pick 3 out of that 20 for you to perform. You may not get this one, but you might. And it is a very, very, very long skill. Okay. This is a mannequin skill. It's not going to be done on a live person. That mannequin will be laying in bed for this skill. Documentation is not required. If you go to page 127 at the top, you can see the care plan. It's a long care plan. We're going to go over it step by step in a moment. We've got step-by-step instructions that tell us what to do. Down here are all of your supplies. Again, you have to learn those supplies. There's no way around that. But I want to bring your attention to right here. This is kind of your short version of the skill. We'll come back to this in a little bit. Let's look at the care plan. Long care plan. It tells us to provide a partial bed bath. So let's stop there for a second. If somebody said to go give a bed bath, that means wash the entire patient, front and back, everything, right? We're going to clean the patient, like you in a shower. You clean everything. You don't just clean your right foot. You clean everything that's there. So a bed bath would be to clean everything. The fact that this says partial means we need more information. Okay, I have to just wash parts of the body, but what parts? What do you want me to wash? Remember, we don't get to make that determination. Who does? The nurse. They're going to write it down in the care plan. So that's what the rest of this care plan is about. Because it says partial, it's got to give us details. Okay? So it says, it also tells us to give a back rub. We'll get to that in a minute. It says wash the resident's face, neck, chest, abdomen, back, and one arm and hand. It doesn't say right or left. You get to choose, but one arm and hand. So a quick way to remember this, let's go back to this page, is this. Okay, this is kind of our short version. Partial bed bath is face to waist, front and back, one arm and hand. Good? Good. All right. It also tells us to provide a brief back rub with lotion. This is to make them feel better. This is to wake up those nerve endings and restore circulation. This is not deep tissue. We're not trying to get the knots out. We're not masseuses. This is simply real quick, 3 passes, small circles up to the shoulders, come back down, small circles up to the shoulders, one more time, small circles up to the shoulders. Okay, we're done. That's all this is. Remember when you were a kid and you didn't feel so well, mom came along, just kind of rubbed your back a little bit, always made you feel better? That's what we're doing here, okay? It tells us to dress the resident in a hospital gown. Well, that makes sense. Clean bodies need clean clothes. All right? Patients lying on back, center of bed can move as directed, can roll as directed, but cannot assist with bathing.
so we can ask her to turn on her side. Now, the problem is she's a mannequin. She really can't. We're going to have to turn her. Mannequins are like giant Barbie dolls. They do not lay on their sides by themselves. If you've ever put a Barbie on their side, they don't stay there. So for this skill, the evaluator is going to be standing near the end of the bed. When you turn the mannequin over on her side, the evaluator will reach over and hold that mannequin. They know mannequins don't lay on their sides. Real people do, though. Good? Questions? These are all the principles, but we know all of these. We know to follow the care plan. We know knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to give you a partial bed bath. Is that okay? Awesome. I'm going to close curtain, go wash my hands, and then I'll get my supplies. I'll start with a barrier on the table. I'll get all of the supplies that I need for this skill, which is 2 towels, 4 washcloths, soap, lotion, clean gown, privacy blanket, and gloves. Once I get everything on all my supplies on the table, then I'll put the privacy blanket over the patient, over the sheet, pull the sheet down underneath, make sure I'm not holding anything up next to my uniform. I'll go get some water. I'm going to check it. I'm going to ask them to check it. It should feel warm, not hot, not cold. I'm not going to put soap in the basin. I put soap on the wet washcloths. Whatever I wash, I rinse. Whatever I rinse, I dry. I'm not going to get the bed wet, so I'll protect it with a towel. I'll wash everything the care plan told me to. Face first, no soap. We don't put soap on the face. Soap dries the skin. Okay? Make sense? At the end of the skill, I'm going to put all of my dirty stuff in dirty linen. I'm going to make sure my patient looks comfortable, take my gloves off, pull the sheet back up and remove the privacy blanket, put that in dirty linen. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? Here's your call light. Open the curtain, wash my hands. My skill is done. So we know all of this. There's nothing on here that we haven't seen before. But now we want to learn a part of washing rules that we did not go over yet. And I told you during the review where we're going to come back to this. So we've learned everything on washing rules except for this one small little tiny piece. And that is coming up. So to review washing rules, we're not going to put soap in the basin. We're going to use a paper towel to turn the faucet on. We'll check it. It should feel warm. Your patient will check it as well. Whatever you wash, you rinse. Whatever you rinse, you dry. If the water gets cold or soapy, we're going to change it. Don't get your surface wet. Lotion gets warmed up and then wiped off. So the last principle that we need to learn with washing rules is this one. We're going to use Leaves method for wet body openings. So you guys get to play along with this. I'm going to pass out washcloths. Those of you who are playing along at home, if you have a washcloth hanging around, like in a laundry linen closet or in your laundry room or in your bathroom, go get a washcloth so that you can play along with this as well. Now, we're going to use this Leaves method if we're going to wash any wet body opening. And if you remember way back in class 2, we learned what wet body openings are. Well, for this skill, it tells us to wash the face. The face has eyes, nose, mouth, wet body openings. So we have to use a special method to prevent cross-contamination. That special method is called the Leaves method. So if we have a washcloth, they are folded in half and then folded in half again to make a small square, right? We're all familiar with this, right? Small square. But instead of looking at it like a square, I want you to look at it like a diamond. And the diamond specifically, I want the free corners at the top, not like this, not the folded corners and not this one folded. We want the free edges at the top. Now, when I take this washcloth in a diamond shape with the free edges at the top, I'm going to put it in my dominant hand with the free edges pointing up. I'm going to tuck in this corner between my thumb and index finger, and I'm going to tuck in this corner between my pinky and ring finger, like this. Good? Everybody got it? This lets me wash something. So let's say I'm washing the face. I'm going to wash the eye, inner to outer corner. Now I've got eye gunk on there. So I'm going to fold that leaf down, and that traps that eye gunk underneath. Now I've got a new area I can work with, and I can wash the other eye, inner to outer corner, and fold that down. Now I can wash the rest of the face, and I can fold that down, and I can wash the nose last because of boogers. We're going to do that last. Fold that down. This is called the leaves method. We're going to use this anytime we're washing any wet body openings, which is any of these. So you're going to see this method again on Wednesday with pericare. And you're going to see it again on Monday with catheter care. Good? Good? So it's not the last time you're going to see this method. So in picture form, this is exactly what we just did together. We're holding the washcloth and we wipe something and we fold that leaf down, leaving us another clean area. And then you fold that leaf down using another cleaning area. You fold that leaf down, leaving you another cleaning area. And then you can fold it over, and you can actually use the back side as a fifth side if you need to, which we will on Wednesday. Good? This is the leaves method. Very, very useful. I actually use this on my kids just as much as I have at work. This is an amazing way of creating multiple clean areas on just one single unit. Good? All right, since we know all of this, let's concentrate then on our skill-specific steps. So our care plan tells us to wash face to waist, front and back, one arm and hand. And that's because that's exactly what our care plan says. That's what we're going to be judged on. That's what we're going to be graded on. We want to make sure that we're only washing these areas. So you kind of have to pay attention to this care plan. We're going to wash the face first. No soap on the face. Soap dries the skin, gets into the eyes, it stings, it's no good. So no soap on the face, just water. But whatever we rinse, we dry. So make sure you dry the face after you clean it. We're going to use that leaves method when we're cleaning the face, controlling it to make sure that, we don't have like free edges that are slapping her and stuff. You want to control it. You're going to wring it out thoroughly. And then we're going to wash. So the way that we do the face, let me go back. Got a lot. I missed it somewhere. I don't have the face on here. Where'd my face go? Hold on. I know I had one somewhere. Oh, there it is. Okay. There it is. No, I got it. Okay. So I've got my washcloth in my hand, and I'm going to wash inner to outer corner on one eye and fold that over. I'm going to wash inner to outer corner on that eye and fold that over. I'm going to wash the rest of her face, fold that over, and then the last leaf, I'm going to wash her nose last, just because I don't want to spread, boogers. Okay, and then I'll set that down. Now, I didn't use soap, so this is basically a rinsing washcloth. What comes after rinsing? Drying. So I want to make sure that I take a towel and pat dry all of those areas. We don't leave her face wet. That's the number one misstep on this skill, is drying the face. What's that? Nope. We're just going to put lotion on the back. All right. So we're going to make sure that we control that washcloth. We wring the washcloths out and we apply soap directly to the washcloth for the rest of the body. We're just going to wash the neck, under the chin, across the chest, down to the abdomen, down to the belly button, up the side. We're going to go down one arm and hand, up the back, do the armpit last because it's an armpit. right? Whatever we wash, we rinse the same way. So I'm going to wring a washcloth out. I'm going to rinse under the chin, across the neck, the chest, all the way down to the tummy, up the side, down the front of the arm, up the back of the arm, and the armpit last because it's an armpit. Whatever I rinse, I dry. So I'm going to dry under the chin, across the neck, the chest, down to the abdomen, up the side, down one arm, and up the back. Armpit last because it's an armpit. Good? So whatever we wash, we rinse, whatever. This is not hard. This is not hard. But we do have to talk a few things here. She is a mannequin. She is plastic. She is molded. Her breasts stick up. They don't move. Real people don't work like that. So you're going to see in the video, when I lift the breast, I lift with the back of my hand. So I go under the breast and lift like this to clean underneath. When you do that, it makes it less personal, a little more clinical. Make sense? Okay. We want to limit how much we're exposing. So for the test, we're going to leave her covered with the privacy blanket and clean under the blanket. But at some point, they're going to ask you, hey, can you move that blanket, please? You need the checkpoint for privacy. You need that checkpoint. So don't pull the blanket down until they tell you to pull the blanket down. Okay? Good? Questions? Okay. When we're lifting the arm to clean, we always lift from below with a flat palm, supporting at the joints. We know this. Everything we use is going to go off to the side of our basin. Now, I do want to talk to you just a little bit about washcloths. If you look at the supplies for this skill, you'll see it says 4 washcloths. And I want you to learn how to do this with 4 washcloths, because out there, you're not going to have unlimited supplies. You're probably not even going to have enough supplies to get you through your shift in most cases. So you have to learn how to do this with the minimum amount of supplies. Good? For the test, if you want to use 5 washcloths, and that way you don't have to reuse any of them, that's great. Go ahead. That's fine for the test, but don't take 10. If you try to take 10 washcloths, they're going to tell you, you don't need that many. Because there's other people testing that day that are going to need washcloths, and this is all they've got right here. This is it. They can't go down to the store and buy more washcloths. You're stuck with what they've got. And if you use 10 and you use 10 and you use 10 and you use 10 and you, by the time we get to you guys, sorry, there's no washcloths left. You can't test today. That's a bummer, right? So they're going to tell you, I'm sorry, you don't need that many washcloths to do this skill. So 4 is the minimum. 5 is fine. Any more than that will be flagged. Make sense? Okay. So what's the difference between 4 and 5? Here's the thing. In a perfect world, everything you use, you set aside. Remember hand and nail care? We use the washcloth, we set it aside. Then we used a rinsing washcloth and set that aside. Then we dry, right? So we use something, we set it aside, right? Make sense? You don't want to put a soapy washcloth back into the basin because now your rinse water is soapy. Doesn't work for rinsing. Good? Make sense? Okay. Those are all rules. No soap in the basin, no soapy washcloths back in the basin. But you can reuse a rinsing washcloth. Okay, good? Makes sense? That's what you're going to see me do for this skill. I am going to reuse the rinsing washcloth on the back. So we wash the front, we rinse the front. That washcloth is going to go back in the basin so I can put soap on it in a minute and wash the back. That way I can use 4 washcloths for this skill. That's what you're going to see. Now, if you want to use 5 and not reuse anything, you can do that on the test. but I need you to know how to do this with 4 because out there, that's probably what you're going to have to work with. Okay, so remember our principle here. Anything with soap on it doesn't go back in the basin, but a rinse washcloth can be reused. Now you want it back in the basin though, because you don't want to leave it out and let it get cold. Nobody wants to be washed with a cold anything. Make sense? All right, then you're going to scoot your patient towards you. You're going to roll them up on their side. You're going to wash the back. You're going to rinse the back. You're going to dry the back. And then we're going to get some lotion, warm it up in our hands, and give them a little back rub from waist to shoulders. Small circles up 3 times. There we go. And then we'll wipe off that excess. Now, let's talk about the gown. Remember our care plan said that we're going to change the gown, right? If you wash the front, rinse the front, dry the front, turn them over, wash the back, rinse the back, dry the back, turn them back, and then put the gown on, you got to turn them back over to tie that gown. That's a whole lot of work. It's work for them. It's work for you. It's just work. There's an easier way. Remember, I'm all about time management, right? Make these skills as short as we can. We got a lot to do and not much time to do it. So, when you start the skill, you're going to take that gown that's on the patient, the dirty gown, you're going to untie it, and you're going to push that, take it off of one arm, and you're going to push that gown all the way to the other side of the patient. You're going to get it out of your way so you can wash, rinse, and dry the whole torso. Get it out of your way. But once you've got a clean torso, if you change that gown then, okay, put the new gown on. You got a clean front. Put the new gown on, take the old gown off, put it in dirty linen. They've got a new gown on. When you turn them over, wash, rinse, dry the back, give them their little back rub, all you have to do is tie that gown, and you're only turning them once. Make sense? Good. So it's easier if you change the gown before you turn them. Easier to change the gown before you turn them. Now, if you want to just wait to the end, put the gown, it's fine. You can do that, but it's more steps for you. Yeah. Yeah. It's open until you tie that gown. Good. So let's see how we're going to use all of these principles to check off all of these checkpoints. A lot of checkpoints, guys. It's a long skill, 19 minutes. Long skill. So we're going to follow that care plan and wash exactly what they tell us to wash. Now, this is one skill that you may have to. Remember, you get this at the beginning of your skills. Remember this? Right? You want to put this in a place that you can easily read it, like maybe on top of their bedside cabinet. And when you start working this skill, your brain is going to shut down and you're not going to remember what was I supposed to wash. You want it where you can see it. So when you're doing the skill, you can just look over and say, okay, all right. So face, neck, chest, abdomen, one arm and hand, back. Okay, got it. You can read it right off of there as you're doing it. So this is because the care plan is so long. This is one that you want that care plan right in your work area so you can read it very easily without having to stop what you're doing. Good? Make sense? All right. We're going to do our opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. And I'm going to talk to the mannequin just like I would talk to anybody else. I'm here to do a partial bed bath. Is that okay? Awesome. The evaluator will play the voice of the mannequin. They are going to answer for you. So awesome. Let me close the curtain, go wash my hands, get my supplies. I'll be right back. Once you close the curtain and washed your hands, we'll evaluate if we need gloves. We know we need gloves for this one. We're going to get a barrier to put everything on. So go get the barrier first. Go get your supplies, including your gloves. Put them on the barrier. We're going to use a privacy blanket. Don't hold anything up next to your uniform. While you're performing the skill, please make sure your patient remains in the middle of the bed. Safety counts. All of our washing rules are going to count. So I'm going to get water. I'm going to check it. They're going to check it. Don't put soap in the basin. Don't let the basin get cold or soapy. If it does, change it out. Whatever I wash, I rinse. Whatever I rinse, I dry. If I put lotion on, I'm going to warm it up first, wipe off the excess. And of course, we're going to use the leaves method for this one. After the skill, I'm going to clean my basin the way I clean all basins. I'm going to rinse it, I'm going to dry it, and I'm going to put it away. And then I'm going to do my the skill specific steps. But if you notice, there's not very many of them. Not very many at all. And then we're going to do our closing. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine before I go? She's a mannequin. She'll say no. Here's your call light. Bed's in the low position. Environment's clean. I'm going to open your curtain, go wash my hands. And after washing my hands, I'll tell the evaluator my skill is done. Good. This is not a hard skill. It is a long skill, but it is not a hard skill. Now, the good news is if you get this skill on the state exam, you get 2 super short skills to go with it, like range of motion, elbow and wrist, and pulse. 3 skills on the state exam. 1 is an ADL skill, 1 is a documentation skill, and 1 is a mobility skill. Page 24 goes over that for you. Okay. Remember that this care plan is only for this patient. We've gone over this before, and we're going to go ahead and watch the video. Video has good close-ups of exactly how to do this. After the video, I'm going to sign off of online, all the people that are joining us here. We're going to pass out the review sheet for today, and then I'll open it up for practice for you guys, okay?
Patty, I do have one quick
Yes.
question. Now, I know we're all going to be a bundle of nerves on time.
Absolutely.
But, like, say her and I are in there and I get a little clumsy and a linen touches my uniform. Would that be a point to make a correction?
Yes, you
So
would
that'd
want to
be
correct
there.
that. I would say I wouldn't have let this touch my uniform, or I would put this in dirty linen now that it has touched my uniform. The evaluator is going to tell you, just proceed. Thank you for recognizing, just proceed. Okay. What they want to see is, do you recognize it? Now, there's also the other thing that they're testing you on that I haven't even talked about in here is ethics. Okay. If you make a mistake in a clinical setting, in the real world, what are you going to do with that mistake? Are you just going to go on like you never made a mistake at all and let the chips fall where they may with the patient? Or are you going to own the mistake and fix it? So during the exam, if you make a mistake like that, you know, let's say the washcloth falls on the floor. Would you pick that up and use it on the patient? So we would want to acknowledge that verbally. I would not use that washcloth. I would go get a new one. The evaluators, they don't want you using up all of their supplies because there's lots of people testing. They'll tell you just proceed from here or go get another washcloth. Now, let's say we have to. Let's just say for a second, washcloth falls on the floor, because sometimes they do, and you have gloves on. Can you reach into that clean supply cabinet with dirty gloves on? No. So what would you need to do?
Wash my hands.
Ah, there it is. Take your gloves off, wash your hands, go get the supplies that you need, and glove back up with new gloves. These are the things that they're kind of looking for, right? So, and it's not about passing the test. It's about, what are you going to do in a real world setting? Because we know this stuff is going to happen, right? Somewhere in your career, you're going to drop something on the floor. What are you going to do with that? How are you going to handle it? Are you going to be ethical, or are you going to just use it on the patient anyway? So by you verbally acknowledging it, you're addressing those ethics concerns. Make sense? Good? Okay. Jake, take her away.
Good morning, Miss Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. I'd like to provide a partial bed bath. Is that okay? Wonderful. I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. Now that I've washed my hands, I can gather my supplies. I'm going to place the supplies on the overbed table. We'll start with a barrier, unfolding the barrier so the absorbent side is facing up, and this gives us a clean place to put our clean supplies. For this skill, we're going to need 2 towels, 4 washcloths, 1, 2, 3, and 4. I need a private blanket and a clean gown. Being careful not to hold the clothing against your uniform. I'll bring this over to the patient area. We'll bring this over here within reach, and then I'm going to get the supplies out of the drawer that I need. We're going to open the middle drawer and remove the basin, soap, and lotion. I'll put these on the overbed table. And I'm going to get a set of gloves. Okay, Miss Jones, I'm just going to get some water in the basin. I'll be right back. I'll use a paper towel to turn the faucet on. Check the water temperature with the inside of my wrist. It should feel warm, not hot, not cold. And we'll fill the basin about a quarter of the way full. Okay, Miss Jones, I have the supplies here. Would you like to check the water temperature and make sure it's okay? It's good? Very good. Okay. So I'll put the washcloths in the water. And the first thing that we're going to do is place a privacy blanket over you. This is going to help keep you warm and provide privacy while we do this skill. We're going to spread this out without snapping it or shaking it. Placing it over the sheet. And I'm going to pull your sheet down to just below your waist. Okay, now I'm going to put the towel on the bed. This is going to help keep your sheets dry, and we'll untie your gown. So I'm going to help you sit up by putting my hand on your upper back, and on the count of 3, we're going to sit. 1, 2, 3. Very good. I'm going to untie your gown. And then we'll spread that towel out underneath the areas that we're going to wash. Come on back. Very good. And I'm going to remove the gown on the side closest to me, supporting at the elbow as I lift. Okay, Miss Jones, go ahead and bend your elbow. Thank you. And then we'll move the gown over to the other side, making sure that you're covered at all times. Now we're ready to start washing, so I'll go ahead and put my gloves on. We'll take the first washcloth, wring it out really well, and then I'm going to hold the washcloth in my hand so the free leaves are at my fingertips, and tuck in the 2 side corners. And this allows us to use a different leaf for each area that we're going to clean on the face. After wringing out the washcloth, no drippy wet washcloths, we're going to wash your face first. I'll start with your closest eye, and we're going to wash inner to outer corner using the leaves method, which is going to help prevent cross-contamination. So with the first leaf, we're going to wash the inner to outer corner of this eye. We'll fold that leaf over. And with the second leaf, we'll wash the inner to outer corner of that eye. Fold that leaf over, and with the third leaf, we'll wash the remaining skin of the face. We'll fold that leaf over, and with the last leaf, we'll wash the nose. And we're going to put this on the barrier. Whatever we rinse, we dry. So I'm going to take the towel and fold it around my hand so I have control over it, and I'm going to pat all of those areas dry using short, soft strokes or a patting motion. We'll set the towel aside. Okay, now we're going to take washcloth number 2 and wring it out really well so that it's not drippy wet. And then we'll apply soap to the top leaf. We're going to start cleaning the neck, behind the ears, under the chin, across the neck, the upper torso, down to the breast, keeping the patient covered at all times to protect modesty, down to the belly button, and up the side. Now, for the test, you will keep the patient covered. The evaluator will ask you to move the blanket if they would like to see. I'm going to go ahead and remove the blanket now so that you can see what I'm going to do. So we're going to move the blanket down, and I'm going to start again to show you how to clean the patient. So under the chin, behind the ears, across the neck, the upper chest, around the breasts. When you lift the breasts, we lift not with the palm, but with the back of our hand to lift the breast to clean underneath, down to the belly button, up the side, down the front of the arm, all the way to the hand, supporting the elbow at all times, either with your hand or the bed, up the back of the arm, and we'll clean the armpit last. We're going to set that on the barrier. Whatever we wash, we rinse. So I'm going to get a rinsing washcloth, and we're going to rinse all of those areas the same way. So behind the ears, under the chin, across the neck, upper torso, around the breasts, down to the belly button, up the side, down the shoulder and the front of the arm, supporting the elbow, the hand, lifting the arm from below, washing the underside of the arm and the armpit last. We'll set that washcloth back in the basin for future use. We're going to take the towel, controlling the edges, and we're going to pat all of those areas dry or use short, soft strokes. Nothing vigorous. So the abdomen, down the arm, lift the arm up, support at the elbow, dry the hand, lift the arm to dry the underside of the arm and the armpit. We'll set this aside. Now, the care plan only asked us to clean one arm. So we don't have to go over and clean the other arm. And that's because that's what the care plan instructed. In some cases, you will have to clean both arms. In that case, you would just do that at this time. But for right now, we only had to clean one arm. We did that, so we're going to dress the resident in her gown. I'm going to spread the gown out, put my hand in through backwards on the armhole, lift her hand by holding her fingers together to place the sleeve over the arm, and then I'll lift at the elbow to bring the gown up. I'm going to make sure that gown is covering her. Put the privacy blanket back in place, and now I'll go to the other side of the bed to remove the old gown and put the new one on. Okay, now I'm going to move the blanket and remove the gown from this arm by sliding it off the arm, lifting the elbow from below with a flat palm, and then this will go in dirty linen. Now I can put the new gown on this arm by putting my hand in through the armhole backwards, grasping her hand, and sliding the gown over. We're going to lift from below at the elbow and make sure that the gown is properly in place. Now I'm going to go back to the other side of the bed. Okay, Miss Jones, I'm going to wash your back now. So I'm going to pull you toward me and turn you up on your side, and that way you're in the middle of the bed after the turn. Okay, go ahead and slide toward me. And then you're going to roll on your side. 1, 2, 3. Thank you very much. The evaluator will hold the mannequin in place during your cleaning, during the test. Live patients, of course, can lay on their side. So I'm going to ask the evaluator to please hold the mannequin in place for me. Thank you. We'll slide this towel down so it's covering the bed underneath the back. We're going to take our third washcloth, wring it out really well, and we'll apply soap to the top leaf. I'm going to wash the back from the neck down to the shoulders, all the way down to the waist. We'll set this washcloth aside, and we'll get our rinsing washcloth. So we'll wring that out, and we'll rinse the same way we washed. The back of the neck, the shoulders, all the way down to the waist. We'll set that aside, and we'll take our towel to dry those areas. So I'm going to pat dry or use short, soft strokes and dry all of those areas. Now the care plan asks me to provide a brief back rub. So I'm going to take my lotion, put a little bit in my hands, and then I'm going to warm it up by rubbing my hands together. We're going to start at the base of the back and go up in small circles to the shoulders, and we'll do this 3 times. To the shoulders, come down, up to the shoulders and come down. And then we'll take the towel and wipe off the excess lotion. We'll remove that towel from the bed, putting it on the overbed table, and then we'll tie the gown. Come on back, Miss Jones, onto your back, and then scoot to the middle. Thank you. Okay, you're covered and safely in the middle of the bed. Let me go dispose of all of my supplies, and I'll be right back. So I'm going to put all of the supplies in dirty linen, being careful not to hold them against my uniform. And now I'm going to clean my basin, and we'll dispose of the water in the sink. Rinse the basin, and then dispose of the rinse water into the sink as well. I'm going to set that down, disinfect it per facility policy, and then pick it up with a paper towel. I'm going to get a clean paper towel to dry the inside. I'm going to get a clean paper towel to dry the outside. And then one more for the drawer. Okay, on the way, I'll place the lotion and the soap into the basin using a paper towel. And then I will use the paper towel to open the middle drawer and slide the basin with the soap and lotion into the drawer. We'll close the drawer with a paper towel and then throw them away. I'm going to remove the barrier, throw it away, and then I can remove my gloves. Okay, Ms. Jones, I'm going to move your privacy blanket now. So as I pull the blanket up, I'll restore the sheet. This preserves modesty and keeps the patient warm. We'll roll the privacy blanket up in a ball so that trailing edges don't contaminate other surfaces. Okay, I'm going to place this in dirty linen. We'll return the table to storage. Adjust the sheet for neatness and appearance. Okay, Miss Jones, are you comfortable? Is there anything else I can get for you while I'm here? Okay, let me place the call light in your hand. So there you go. The call light is in your hand. If you need anything at all, please press that red button. We'll be happy to come help you. Bed is in the low position. The environment is clean. I'm going to open your curtain and go wash my hands. After washing my hands, I'll review the care plan to make sure that everything in the care plan was addressed with this skill. I'll think about my skill and make any corrections that need to be made. And once I'm happy, I'll tell the evaluator my skill is done.
All right. Any questions on partial bed bath? It is the longest skill, but it really isn't all that difficult. You know, just follow the care plan, remember all the principles we've learned and apply them. And that's really all there is to it. And I think this is why students say that denture care is harder than partial bed bath. Partial bed bath's a little bit longer, but denture care has two distinct components to it. And it's the crossover that might get you a little confused. So we're going to open up for practice now. So everybody that has joined us virtually, thank you so much for joining today. We will be back on Wednesday at 9 a.m., but we're going to go ahead and sign off now so our students can practice. If you're watching us from home, make sure that you're practicing somewhere as well, and that'll increase your likelihood of passing the exam. Once you pass the exam, come back and let us know because we would love to congratulate you. Until next time, happy caregiving. Bye.